Hi guys, Honestly Invisibly Sick here, and as you may or may not know, the month of May is Lupus Awareness Month, and I have on my purple in support of all of the lupus warriors out there that are fighting this battle daily. I see you, girl, or man, I see you, but I just thought it might be nice to go back and share my diagnosis story. But before I get into that, I want to get my disclaimer out of the way. I am not a medical professional. This is just my story and what works for me. And also, before I get into that, I want to tell you guys what lupus is in case you're watching this video for the very first time. Which, if you are, that's great because we need more people to know what lupus is. That's the purpose of lupus awareness, is to bring people who don't have lupus or don't know what lupus is to bring it to your attention so that you can see what people who have lupus really go through. And let me just give you the overall symptoms of lupus, kind of like in a nutshell. I'll do another video where I go into more detail with it. And I do have videos where I have, and I'll link it up here in the iCards. I think I did two videos, I think close to 7 months ago was my original diagnosis story. And then I also did another video of lupus and my journey. I think it was like a part 2. Where it just focused on just the lupus part, because I have multiple autoimmune diseases. I have lupus, rheumatoid arthritis, fibromyalgia, hidradenitis suppurativa, psoriasis. I have I'm seronegative, but my doctor keeps telling me that I have Sjogren's syndrome, and I have a plethora of things wrong with my eyes. So I have a gamut of autoimmune diseases, which most people don't know. If you have one autoimmune disease, it doesn't take much to get another autoimmune disease. What is an autoimmune disease? An autoimmune disease is a disease where your immune system starts attacking itself, and that's what happens in lupus. Lupus can cover a wide variety or a wide gamut of body systems within the body. It can affect your nervous system, your musculoskeletal system. Wow, that was a mouthful. I'm a little tongue-tied today. It can affect your circulatory system, which is your heart. It can affect your respiratory system, which is where your lungs are. It can affect your liver, your kidneys. There's just a wide range of organs that can be affected from having lupus. So the symptoms of lupus is, of course, joint pain. A lot of people have joint pain, joint stiffness. You can have muscle pain and muscle stiffness. So pain is like, chronic pain is like the hallmark of lupus. Like, that's just something that you go through. Almost everybody has pain, whether it be joint pain, musculoskeletal. It's different for every person. There is no one-size-fits-all symptoms for somebody who has lupus, because it just, like I said, can cover multiple body systems. It can also affect your skin, and there are different types of lupus, which I'll go into that probably in my next video for next week, because I want just all the month of May to focus on lupus. So like I said, it's stiffness, it's painful joints, painful muscles, stiff muscles. You can have a rash on your skin. You can have swelling. I know I swell a lot, especially in my hands. They swell up like sausages. They're a little swollen today. You probably can't tell because they just look like fat fingers, but I really have skinny fingers. If you'll go back and watch, and I'll put the card here, my rheumatoid arthritis video, actually my fingers were not swollen in that video, so then you can see the difference. But yeah, they're really swollen right now. So it can cause swelling, not only just your hands. Like, I know people that get swelling in their legs and in their feet. I know my toes and my feet and my toes swell. And you can have, like I said, it can affect your eyes. You can have iritis or uveitis, sorry. You can have uveitis that comes in your eyes, which is a form of iritis. So you can have that caused from lupus. You can get pleurisy, which in your respiratory system, which is inflammation of the lining space between your lungs. It can cause cardiovascular problems with your heart. You can cause blood clots in your body. Just a whole bunch of things where your systems can go wrong. It also causes really bad brain fog, which is a very prevalent symptom among those that have lupus that they all share. And it just makes it hard for you to concentrate, and it makes it really hard for you like to focus, to pay attention. I really struggle with that all the time. I forget what I'm doing. But I thought it might be nice to go back and share my story, and I'll dig deeper into the symptoms of lupus in another video this month. But when I first started having symptoms of anything, I would say I normally started with my eye conditions I had when I was 18, and I'll link that below. It's my diagnosis story. It's the very first intro video that I did for this channel. And I always say that it started there, but I really believe now, going back and knowing everything that I know about lupus, I would say my symptoms started when I was around 15. When I was 15, I woke up one day and my back was hurting excruciatingly bad, and I hadn't done anything to make it hurt. I went and visited a friend, and he popped my back, and that kind of, I always associate, like, it really hurt whenever he popped it, so I always associated the pain that I have in my back from letting this person pop my back. But the truth is, it was hurting before he popped my back. And so I just had like back pain on and off since I was 15 years old. And I had issues with my knee. My knee is hypermobile, so it would pop out. And just pain. I would think whenever I would sit down on the couch or whatever when I was younger, I would start getting stiff and hurt, and I would be like, oh, it's because you haven't moved around enough. Not knowing any better. But anyway, that's where I think when it started, but it didn't come to my attention that there was anything wrong until the eye infections, iritis, started. That started when I was like 18, and it continued, I think I was like 18 or 19. It continued all the way throughout my 20s and my 30s. I have not had a bout of iritis for a couple of years now, but it can come back at any moment. There's no, it doesn't give any notice, and it can just come, and it's always reoccurred ever since I've had my first episode. Well, during my 20s, my eye doctor was like, I really think that you have rheumatoid arthritis. Whenever he first said something to me, I didn't think anything of it. I was just like, I'm young, I don't have arthritis, because I didn't know that there was different kinds of arthritis. So, I went on like that, like I would just have a flare-up, he would go and he would treat it. And in 2014, I had a really particularly bad flare of the iritis. Sorry, I can't speak today. And I went and saw him, and this time he said, I really believe you have rheumatoid arthritis. Well, by this time, whenever I had went and had this really bad flare of the iritis, I was having trouble with my hands were hurting, they were swelling. I mean, I was literally going to bed with my hands like this on the covers, because I thought maybe it was because I was balling them up. That was not the case. So I said, I think you're right. So I finally went to the doctor and had the doctor test me for rheumatoid arthritis only, because I didn't know that there was a plethora of other autoimmune diseases. I was just taking his word for it. So, of course, my rheumatoid factor came out negative. So she said, I think you have fibromyalgia. So I was like, okay, great. I Googled it. Nothing serious. They said there was no long-term side effects. I was just going to be in pain. I can suck this up. Not that you should do that. I was just didn't know what it was. So, and I was just young and didn't know what it was. But anyway, that's not what I recommend. Talk to your doctor. Just kept going on with life like that. I have times where I could barely get off the couch, and I just chalked it up to it was fibromyalgia. And then I went and saw another doctor. I switched to my doctor that I had for most of my life. I went back to him, and he was like, yeah, I really do think that you have something more than fibromyalgia, but there wasn't nothing that he could do at the time. I didn't have any insurance, so he didn't want to pull a bunch of blood work. So he just treated the symptoms. And I went on like that for years of him just treating the symptoms as they came up. I had things like pleurisy, costochondritis, which is inflammation of the intercostal space within the rib cage. and I had just different like shoulder flares and just things like that where I couldn't move my shoulder wouldn't lift over my head. So I just kept going like that, and finally I decided to go back to school, um, just for a change in career because I could no longer do anything really physical. So I went to school, I finished that, and I flared almost the whole way through, not even knowing what a flare was, but my doctor again was just getting me through everything that was going on. And finally I got done with that, and then I got hired at a local hospital because I went to school for medical billing and coding, and it was my dream job. I was so excited. And right around the time when I finally started going to work, my eye flared again, but it flared in a different way. It wasn't the iritis this time. It was called keratitis, which is the inflammation of the cornea. And when this flared, I lost a significant amount of sight with that. So I went to the eye doctor. Of course, he treated it, and it never really got progressively better. So I went to a specialist because he thought that I had MS. He thought that's what it was. Okay, we did the rheumatoid arthritis. Nothing happened there. Now your symptoms are showing that you may have MS because I had a diminished sense of color in my right eye. So I went and I got all these tests done for that. Everything came back negative, but they did go ahead and infuse steroids. So once they infused the steroids, my eye got better. So my eye doctor made a note of it, but I was sent from the neurologist and he said, you don't have MS. So then my doctor and my eye doctor got together and they said, she really needs to go see a rheumatologist then. So I went and saw a rheumatologist. He did a plethora of tests. He said everything came back negative. Actually, it didn't come back negative. My inflammation markers were elevated slightly, and my ANA was a couple points high. But he said, I really think that you have fibromyalgia. So that's what he diagnosed me with. I got a second opinion. It came back the same. So I just left it and I said, okay, well, I just have fibromyalgia. I tried to take treatment for it, and because I have chronic dry eye, it made my chronic dry eye worse, and I had to come off of it. So then I was just like, well, I've been dealing with it all these years. I'll just continue to deal with it. Well, in the meantime, my symptoms got progressively worse. I was so stiff, had so much joint pain, like I could barely get up and down out of the chair at work. I had stepped down to part-time trying to in the hopes that it would help me to not be as stiff and get better. It did not help. So I finally had to stop working. I couldn't get up, I couldn't sit. I had developed sacroiliitis during that time, which is inflammation of the sacrum and iliac joints. So, or area. Could be your joints or it just could be the area. Anyway, so I just had to stop working. And finally, right after I quit working, I went and saw a physical therapist because I was like, well, maybe I could do physical therapy, and my intent was to go back to work, do physical therapy, and then go back to work. Well, the physical therapist told me I would never go back to full-time. She said, it's just too bad, and she put me on a cane. And I just kind of stayed mostly on the cane for a couple of years, and finally I said, I want to go to the rheumatologist just one more time. I want to find out what's going on. Let's spend some time. I'll go to a different rheumatologist that doesn't know me and let them go over my chart and see if they can figure out what's going on. So I finally went and saw another rheumatologist, and she looked over everything. She looked over all the notes that I had from the previous rheumatologist and my doctor and my eye doctor, and she also checked over my joints and asked me some questions, and she ordered blood work. But she told me on my first initial consultation, she said, I really believe that you have lupus. I didn't think nothing of it. I was like, I think it's going to come, because I had already had the psoriasis on my legs, so I just thought it was a cut and dry psoriatic arthritis. That's what I have. Finally knew what I had. Well, when I went to see her again, and my blood work came back, she said, now I am for definite that you have lupus. And that is when I began my journey of I started first on methotrexate, and then I couldn't take that, and then I started Plaquenil. Once the Plaquenil got out of my system, I was able to come off my cane and just do a lot of things that I couldn't do before. I'm no longer stiff every single day. I still have flares, periodically where I'm stiff, where I can't move, but it's not every day like it was before the Plaquenil, or before I got the diagnosis and got on my Plaquenil. So that's my story. So if you are somebody, the reason that I share that is if you are somebody out there who has a disease, or has these symptoms, not the disease, but has these symptoms and you don't know what you have, maybe you could say to your doctor, there's this lady on YouTube and she has all these symptoms that I have, maybe it's lupus. Not saying that that's going to help you, because doctors need to go about it their own way with the blood work and examining you in person. But as somebody who my pain started in 2010 is when I really got serious about trying to get a diagnosis. So I went from 2010 to, no, excuse me. I went from 2014. Oh, I did start hurting in 2010, but I got serious about it in 2014. So from 2014 to 2018 is when I finally got diagnosed. But I had all these symptoms all throughout my 20s. I just didn't pay attention to the warning signs that something really was going on. But I really got serious about it in 2014. So that was like 4 years, but I've had these symptoms, like I said, since I was 15. So if you're somebody out there who's having these symptoms and you don't have a diagnosis, or you went to the doctor and they've told you that no, it's fibromyalgia or it's something else, it's okay to get a second opinion, and it's okay to keep pushing. Sometimes it takes time to get the correct diagnosis, and you just have to be patient and be persistent. It's okay to try different doctors. It's okay to get a second opinion, a third opinion, a fourth opinion if you have to, until you find somebody who's willing to listen to you and take into consideration what you're telling them. Because some doctors just get stuck on the blood work, and it's not all about the blood work. Not everybody's blood work shows exactly the same way. Lupus is different for everybody. No two people that have lupus have the same exact symptoms. And that's just the way it is. That's why they call this the great pretender. That's why they say that about lupus, because it is. It can mimic so many other diseases, and it could take a long time to get the correct diagnosis. So if you're out there suffering, know that there's hope. And if you are somebody who has lupus, keep fighting and don't give up. Thank you guys so much for watching this video. I hope that you found it informational, and I hope that it was able to help you. And just let you know, if anything else, you're not alone. There's somebody else out here who goes through the same thing that you do. And that's it. Thank you so much for watching, and have a blessed day. Bye!